Hello, I'm Dr. Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. The topic for today is, where is my pain coming from? Is it from my hip joint, or is it from a low back spinal problem? A significant amount of the time, patients are dead set sure that their pain is coming from their hip joint, only to realize that actually it was a low back spinal problem that was causing the pain. Pain that occurs in the hip can be coming from numerous areas. One is in the groin, another would be down the front of the thigh, and other areas might be in the buttock or around the outside part of the hip. Pain that occurs in the groin is truly often from an internal hip problem. It might be bony arthritis, degenerative joint disease as it's often called, or a tear in the soft tissues inside the hip, maybe a labral tear, which is often seen in sports medicine injuries. Those kinds of things often cause groin pain. A little known fact is that a patient may also have groin pain from a disc herniation in the low back. An L5-S1 disc herniation can in fact cause groin pain. You're not going to see that typically in textbooks, but that can in fact happen. So one of the major ways to figure that out is on a physical examination. The physician, whether it's an orthopedic surgeon, a pain doctor, primary care doctor, will do a hip exam and see if the pain is reproduced. If it is partially reproduced or maybe not at all, the answer is you need to keep looking to see if the pain may be coming from something going on in the low back. For instance, I've seen patients in the past who had significant or actually mild to moderate degenerative disease in their hip, but it turned out that only part of the pain was coming from the hip. The rest was coming from spinal stenosis in the woman's back. So let's go through a sample patient, okay? Let's say you have a patient named Betty. She's 62 years of age, comes in with hip pain that bothers her in the front of her thigh and in her outside of her hip, and thinks it's coming from her hip. She's dead set on it. Well, in her physical exam, she has moderate pain with palpation of the hip, range of motion. So maybe it's not coming from the hip. Well, what do you do next? Well, x-rays show that there was mild to moderate arthritis in the hip, but an MRI of the low back showed the patient had significant spinal stenosis, where the nerve roots that were trying to get out were being pinched. And that was thought to be a cause potentially of the pain as well. So the patient was then sent to a pain management doctor for what's called a diagnostic injection. Now, an injection can be diagnostic, where it's a test to basically tell if that's where the pain's coming from, or it can also be therapeutic. It can also relieve the pain. So what the pain doctor can do, and our pain doctors do this at Preferred Pain Center, is they can do a hip injection under an x-ray machine so they know they're in the joint. They can inject numbing medication along with some steroid, and within about 2 minutes you'll know. If the patient says, all my pain is gone, then that says that the hip was the problem. If they say 50% of my pain is gone, it may not be that that's all the problem, where the problem's coming from. So then, at a separate setting, the pain doctor can do epidural injections into the area of the back where the spinal nerve roots are getting pinched. If that takes away the pain, then you know that that is where the pain is coming from. So in the case of Betty, her hip injection took away half her pain. So then, a week later, she had an epidural injection that took away another 40% of her pain. So what that says in Betty is that the imaging studies and the exam and the injections altogether showed that the patient had half her pain coming from her hip, 40% from her back, from the spinal stenosis, and 10% she just has to live with that, unless we can get it taken care of with the other options that we have at Preferred Pain Center, which are numerous, include physical therapy, other interventional pain management procedures. We also have chiropractic, physiotherapy, spinal decompression treatment. All these treatments we have available at the center. So look us up on the web, www.preferredpaincenter.com, or call us at 602-507-6550. Preferred Pain Center, the pain stops here.